Hello there, this is Dr. Nicola Ducharme. How are you? So let's talk about biofilm. And this is quite an important topic, whether a patient is treating or a person is treating for candida overgrowth or for chronic Lyme disease and co-infections. This biofilm topic comes up quite a lot. And so I just wanted to kind of give you a brief overview of what biofilm is and how we deal with it as part of our approaches to some of these sort of chronic infections, chronic overgrowth, etc. So, and I'm hoping my connectivity is good. I don't know if somebody can just comment and let me know if you can hear me and see me okay. I've had some issues recently with internet and we've had the guy out, so hopefully it's better. So biofilm, I always say it's like sticky goo. Officially, it's a mucopolysaccharide matrix. I have a 6-year-old, so I'd say it's kind of like slime. Think of it like slime. Now, the thing about biofilm is that a number of pathogens, like these bacteria, thank you, Lee, these bacteria can create their own biofilm to live in and essentially to hide in. So the whole purpose of biofilm from the standpoint of some of these bugs is that it gives them a sort of safe place to hide from the immune system, to hide from antimicrobial therapy. They can live in there, they can communicate in there, they can replicate in there. So they're quite happy in their biofilm. And but the problem is that if there's a lot of biofilm and the pathogens are kind of hidden in there, it makes our therapies less effective. Because you just imagine if you've got these bacteria in this sort of slimy matrix and we're trying to put herbs in there and whatnot, then, or antibiotics or whatever the case may be, it's not going to have as good of an effect. Now, timing wise, when I start working with somebody, whether it's, candida, Lyme, co-infections, whatever the case may be, I never do biofilm stuff right away. And I'm going to talk in a minute about what biofilm stuff actually is. I always wait. The reason is that when we start killing off the pathogens, that can create a Herxheimer reaction. And I'm sure that the majority of you who are sort of living in this world of chronic infections know exactly what that is. And so I never want to expose more pathogens when we're just starting out. So if you picture, just in sort of layman's terms, there's these bugs floating around the system, just free floating. So the antimicrobials are going to hit them first. That could be enough to create a fairly significant Herxheimer reaction, right? So in those early phases, the ones that are in biofilm, I let them just stay there, and we just sort of work on chipping away at the general sort of overall load. But over the long term, there will need to be biofilm agents used along the way. Now, the majority of agents that help to break down biofilm are kind of enzyme based. So I'm going to tell you a few of the different things. There's sort of 3 main ones that I utilize. And there's a couple of other ones out there that are popular. So I'll just touch on those as well. The majority, like I said, it's enzyme based. So if you think of enzymes as helping to break things down, think of it like Pac-Man, like chewing through those little dots. That's what enzymes do. And so sometimes we use enzymes to break down like the products of inflammation. Sometimes we use enzymes to help us break down food. Sometimes we use enzymes to help break down biofilm. So some of the more common ones, nattokinase, serrapeptase, and lumbrokinase are ones that are utilized a lot. Now, I saw some research that Eva Sappi had done. She's a PhD, and she had found out of the 3 of those, lumbrokinase is actually the most effective. So one of the things I use a lot is Belukhi's lumbrokinase. It comes from Canada. We get it through Research Nutritionals. And that is excellent and very high quality to help with that biofilm, to help break it down. Nattokinase and serrapeptase are both less expensive than lumbrokinase. Lumbrokinase is not cheap. It is probably the most effective, but it can, it can add a cost onto the whole supplement regimen. Nattokinase and serrapeptase are two other enzymes that are utilized quite frequently. I don't use those individually as much, but many people do. Now, one of the considerations is like, where are these enzymes coming from? And so lumbrokinase is derived from earthworms, and serrapeptase is derived from silkworms. They're like enzymes that they can source from silkworms. Nattokinase is made from fermented soybeans. So for the strict like vegetarians and vegans, nattokinase is going to be the best bet. Now, the other formula, there's a couple of formulas that I've used a lot. So one of the things is Bolucki lumbrokinase. The other formula I really like is Interphase Plus by Claire Labs. And it's a good broad spectrum biofilm breaker. I've used it a lot, especially in kids like candida issues. I think I potentially like it a little bit more for candida. When I'm working with Lyme, sometimes I'll combine it with lumbrokinase just for the best effect. I will less commonly use it on its own in a Lyme patient. The thing to know about Interphase Plus is some of the ingredients are derived from eggs. So if you're very intolerant to eggs, that would not be a good choice for you. The other one that I really like that I've been using more recently is called BioDisrupt. It's by Research Nutritionals. And it does have some of the enzymes. It also has peppermint oil, which is helpful for breaking down biofilm. When I was doing a lot with essential oils, peppermint was always part of the regimen. But it also has some herbs in it. So it's very reasonably priced. It's a nice comprehensive formula. The peppermint is quite strong. So if you're somebody, I'm not sure a kid would really like that. And if you're someone that finds peppermint a bit overwhelming, or if you have a sensitivity to it, then that wouldn't be the one for you either. So I guess, the criteria are how you choose a biofilm agent. Part of it is going to be budget. Like I said, nattokinase is going to be a lot cheaper than lumbrokinase. Part of it is going to be your comfort level with eating or taking in supplements that are derived from earthworms and silkworms. And then some of it is going to be the blends, the formulas. Do you do well with peppermint? Do you not? Can you tolerate eggs? Can you not? For the reasons I've just outlined in those individual products. But like I said, my three favorites are the Bolucki lumbrokinase, the new BioDisrupt from Research Nutritionals, and Interphase Plus, which is by Claire Labs. The other thing is I use a lot of biocidin in my practice. It's a great antifungal. It's a good general antimicrobial. And that actually does have some ingredients built in that help break down biofilm. There was also some research done on stevia and whether it could help break down biofilm and whether it indeed was antimicrobial. I will be quite honest, I have not seen like super duper great things with stevia, but that's just my personal experience talking to a limited number of patients about it. So that's kind of your basic overview on biofilm. At some point in your Lyme treatment or in candida treatment, you will want to address this. And I talk about it in my course, The Candida Solution, and I talk about it in my course, Lyme Ed. And so I just wanted to add a note on that front because we are now at May 29th. And so we're in the last couple of days of the special pricing on my Lyme Ed online courses. So till the end of this month, till the end of the 31st, both Lyme Ed for patients and Lyme Ed for practitioners are both $97. That's less than half their regular price. There's 24 hours of training in there. And so I really go through everything. And there are a couple of modules on like the basics of Lyme and what is it and what are the co-infections and what are their symptoms. But I talk about, the different options for testing, how to get the most out of your testing. What are some of the other labs that you should be looking at running other than just the straight Lyme panels? There is a module on antibiotic therapy and more allopathic treatments. But I'd say that the guts of the course is really on the sort of more natural and integrative approaches. So there is an entire module on detoxification. There is an entire module on nutrition. There is an entire module on herbal therapies. There's a module on hormones and how they're impacted by Lyme, thyroid, adrenals, reproductive hormones. There's a whole module on digestive issues in Lyme. There is a module on the psycho-emotional elements of Lyme. I talk about things like, you know, what do you do if antibiotics stop working for you? Or and things that people don't talk about, like what does long-term recovery from Lyme really look like? Like, let's get real about it. What does remission look like? What does that mean? What does living with Lyme long-term mean? So it's packed full. It's my labor of love, that course. It's like everything I know about Lyme up here is in that course, and I want you guys to have it so much. So I thought for Lyme Disease Awareness Month, I would just discount it and make that a special offering for the month. So if you haven't caught that yet, I will put the link in the comments, and I would love for you to be a part of that. All right, folks, have a wonderful rest of your day, and I will see you very soon.